Welcome back to Healthcare Administration 101 from Wealthcare INC. In this episode, we are stepping back to explain one of the biggest forces shaping the healthcare experience, health insurance. Health insurance affects where patients can receive care, what services may be covered, what providers get paid, and what rules healthcare organizations have to follow. At its core, health insurance helps pay for healthcare services. Patients, employers, or government programs pay into a health plan, and that plan helps cover certain healthcare costs based on the patient's benefits, coverage rules, provider network, and cost-sharing requirements. But having insurance does not mean everything is automatically covered or fully paid. Most plans have rules around covered and excluded services, patient payment, referrals requirements, prior authorizations, and network restrictions. We will explore each concept further. First, let's get familiar with a few key terms. A deductible is what a patient pays before the plan covers certain services. A copay is a set fee for a visit, medication, or service. Coinsurance is a portion of the cost the patient pays after meeting the deductible. Another important aspect of health insurance is prior authorization. This is when approval is needed from the health plan before certain services, medications, tests, or procedures. The aim is to ensure the service aligns with coverage and medical necessity rules. Networks matter too. Health plans often work with specific doctors, hospitals, and facilities. These are in-network providers. Going out of network can lead to higher costs or different coverage. It is critical to understand how your insurance benefits are set up to prevent delays and extra costs. Health insurance comes from various sources, each with its own approach. Many people get insurance through work. These plans are managed by private companies, and employers often help with the cost. Plan details can vary, so it's important to understand benefits, networks, and rules. Medicaid helps those who qualify based on income, disability, or family status. Rules differ by state, so it's crucial to know eligibility, coverage, and documentation. Medicare is for older adults and some with disabilities. It has specific coverage rules and billing requirements. Medicare Advantage is a private option under Medicare. These plans, offered by approved companies, often include provider networks and care management models. Some buy plans from the individual marketplace. These can vary by state, network, and cost. Knowing the payer helps avoid delays and ensures smooth communication and care. For healthcare administrators, insurance is not just background information. It shapes the workflow before, during, and after care is delivered. One of the first things administrators need to understand is plan design. Different plans can have different networks, benefit rules, referral patterns, and prior authorization requirements. That means the same service may be handled differently depending on the patient's coverage. They also need to understand payer requirements. Each payer may have its own rules for documentation, medical necessity, coding, claim submission, and reimbursement. If teams do not understand those rules upfront, the organization may face delays, denials, rework, or underpayment. And finally, administrators need to understand patient financial responsibility. Deductibles, copays, coinsurance, and out-of-network costs can change what the patient owes. Clear communication matters because confusion around coverage and costs can quickly become a patient experience issue. When administrators understand these pieces, they can help teams verify coverage earlier, prepare patients better, reduce avoidable denials, and make the healthcare process easier to navigate. So the big takeaway is this: health insurance is more than a card a patient brings to the doctor's office. It is the set of rules, benefits, networks, costs, and payment arrangements that shape how care is accessed, approved, delivered, and paid for. When healthcare administrators understand insurance clearly, they can help reduce delays, prevent avoidable denials, improve patient communication, and keep the healthcare system moving more smoothly. In the next episode, we will break down value-based care and explain why healthcare is shifting from simply paying for more services to rewarding better outcomes, lower costs, and stronger coordination. If you want clear, practical insights on the business of healthcare, subscribe to Wealthcare Inc. Thanks for watching.